Studies from the National Institutes of Health have shown a prevalence of clicking or popping noise in the temporomandibular joint, the TMJ, in the general population up to about 65%. You know, it's also been found that 8 to 15% of our population has significant issues with that TMJ or their bite. It all adds up to potential big problems, including some bad headaches as well. Joining us now to talk much more about this issue, Dr. Ray Becker with Howard County Smiles. Welcome back, Dr. Becker.
Thank you so much for having me.
It's great to have you here. Look, this is an important issue. A lot of people out there, millions obviously, but even right here in Maryland, they have that clicking sound.
Yeah.
And maybe they just shrug it off and they say, well, I'm getting older, but you say, wait a minute here. You may want to get this checked out.
Sure. It's very easy. We have some techniques that let us actually objectively get information to see, does that noise matter? So since 65% of the population has noise in their joint, it's well, when does it matter? When does it not matter? So with these technologies that we have, the JVA, it's a quick, simple test. It's painless. We can do it in just a few minutes, if that. And we can get a lot of diagnostic information on what is the status of this joint. Is it breaking down? Is it something that is causing the pain, or is it something that we can watch and not treat right away?
Yeah, I mean, this test, it's amazing to me that it's something quick and easy. It's something that a lot of people probably don't even know they can get done to get that click analyzed, see what's really going on here.
Yeah, and then maybe not allow it to get to where it becomes more dysfunctional over time. So we actually monitor it and see, is it getting worse? Is it better? Is it the reason the patient's having pain? Is it something that we want to intervene with? As you said, 8 to 15% of the population, NIH studies found that it is important to actually address those patients instead of just watching them.
Let's talk for a second about the click, okay? We know it can cause a lot of problems with your bite, headaches connected to this. And the other thing is, when we hear that click, that's an indication of damage in the joint?
Yes. In order for the joint to make noise, it must be damaged. And that's the actual rub, no pun intended, is that when does that matter? And when is that something that is something you should create or treat, or is it something that you can actually monitor and maintain? So that big question is one of the biggest things we see from patients, is they're not sure, or their dentist told them, oh, you're okay. The joint vibration analysis is a technology that allows us very easily to see, is this something that is important for us to look forward? Are they actively breaking down? Do they have degenerative joint disease, or is it something that is just a noise that we might be able to treat or help them with a simple measure like a night guard, a special type of night guard, not the kind you get from the CVS over the counter.
Yeah, the real deal. You know what's interesting? I think some people out there maybe have a click in their jaw, and they don't even know if they should ask their dentist. They think, well, my dentist, he does my teeth, but I would have to go see like an oral surgeon or go to the hospital. No, dental practices, especially yours, can analyze this.
Absolutely. There is no specialty for TMJ in the dental profession. It's not one of the recognized specialties. So that's where the big confusion comes into play. Patients don't know where to go. So they typically go to their ENT, they'll go to their general physician first. They might go to an oral surgeon. So they really don't have an understanding as to where to go. And since there's no specialty, nobody has that authority, so to say, how to treat this. There's no standardization, there's no protocol. So it really becomes then, how much has the individual dentist, which it is the domain of dentistry, how much has that particular dentist pursued to understand and be able to address these issues for the patient? One of the easiest ways to kind of answer a lot of those questions is the quick, fast, and easy JVA quick test.
Yeah, well, we saw how just easy that test is. Let me ask you this. Last thoughts here, wrapping up. Headaches. People get these unexplained headaches and they're not connecting it to the joint. No. And last thing, you've seen situations where you've been able to treat this, and you've seen these patients gain so much benefit.
It's so much reward to be able to help patients in places where they've not been able to get any resolution in the past. Being able to teach doctors how to do that as well has been a very, very valuable thing. But the patients have really benefited from our being able to finally address these situations instead of just overlooking them.
Yeah, well, it's a critically important topic. People out there that want more information, maybe to make an appointment with you to get that click checked out, HowardCountySmiles.com. You're right there in Ellicott City. Dr. Becker, thanks so much for being here, sir.
Always a pleasure. Always a pleasure, Wyatt. Thank you so much.
A lot of people are going to benefit from this one.
Thank you very much.
We'll be back with more Midday Maryland right after this. Stay tuned.